distinguished ministers, healthcare providers, researchers, physicians, and other participants of the WION Healthcare Summit. I bring you warmest greetings from the Cooperative Republic of Guyana. Permit me at the outset to extend my very best wishes to all who are participating in this important summit. It is a pleasure and an honor to be afforded the opportunity to address you remotely and to join this distinguished gathering of minds committed to advancing the future of healthcare. This summit convenes at a defining moment in human history when technology, innovation, science, and human ingenuity are converging to transform the way healthcare is delivered across our world. Indeed, there could hardly be a more fitting example of this transformation than the historic event in Guyana that recently captured global attention. That event was the groundbreaking, longest distance cardiac telesurgery ever performed. From within Guyana, renowned Indian cardiac surgeon Dr. Subir Srivastava successfully conducted a coronary artery bypass craft procedure on a patient located thousands of miles away in India. In doing so, he set a new world record for the longest distance telesurgery ever performed. This sort of removal procedure used to be the stuff of science fiction. Today it is a reality and is allowing us to break down barriers of geography. Think about what this means for medicine, for a surgeon in one continent to perform a procedure on a patient in another country, thousands of miles apart. In terms of healthcare, technology is rewriting geography. For generations, access depended on where you live. Today, access increasingly depends on what we are willing to imagine and build together. That remarkable surgery was not simply a technological achievement, it was a glimpse into the future of healthcare. It was a demonstration that medicine is entering a new era, an era where expertise can travel faster than airplanes, where knowledge can move instantaneously across borders, and where the best care need not be limited by physical location. It also points directly to the direction in which healthcare in Guyana is proceeding. Guyana is undergoing the most ambitious healthcare transformation in our history, and I dare say, in the history of the English speaking Caribbean, working in partnership with countries across the world, including India, and collaborating with world class healthcare providers and institutions. Guyana is building a healthcare ecosystem designed for tomorrow's opportunities. This transformation is taking place across multiple levels. Level one, healthcare infrastructure. First, we are strengthening the foundation of healthcare by ensuring that primary and secondary care, the care that citizens need most frequently, is available and accessible to all. Our objective is to make healthcare accessible to every citizen. Guyana is building modern, state of the art regional hospitals equipped to provide high quality care while expanding maternal and child health services and increasing the presence of doctors, nurses, and healthcare professionals in communities throughout the country. We have also constructed 25 new health centers and health posts across the country. These facilities are bringing services closer to the people. Level 2, specialty healthcare. The second level of transformation involves catapulting our tertiary healthcare system into the future. We're investing heavily in highly specialized medical services, including advanced gynecology and maternal health care, cardiology and stroke rehabilitation, oncology and cancer treatment, ophthalmology and cataract surgery, and a wide range of other specialized services. We are also constructing a specialized mother and child hospital. Guyana is fashioning a future where world-class healthcare comes to our people rather than our people having to travel to it. Third level, digital transformation. The third level of transformation is perhaps the most exciting. because it involves building a digitally integrated healthcare ecosystem. Telemedicine is already breaking down barriers. Today, in Guyana, a patient in a remote village can undergo an X-ray examination. That image can be transmitted instantly to a specialist located hundreds of miles away. Diagnosis can occur rapidly, treatment decisions can be made quickly, and lives can be saved because technology has bridged the gap between distance and expertise. Guyana currently operates more than 80 telehealth sites, and we plan to double that number within the next year. But telemedicine is only part of the story. We are also building a data-driven, evidence-led healthcare system. From the moment a patient enters the healthcare system, whether for a routine consultation, an emergency intervention, or a complex surgical procedure, their information will be digitally recorded and securely maintained. Their records will follow them wherever they receive care. Healthcare information will no longer be fragmented. It will be integrated, it will be accessible, and it will improve outcomes. We have already commenced implementation of electronic health records at Guyana's premier tertiary hospital, and this process will eventually extend throughout the public healthcare system. At the same time, we are embracing the transformative potential of artificial intelligence. AI-assisted interpretation of medical images is already under exploration. Tomorrow, artificial intelligence will assist clinicians in making complex decisions, identifying disease earlier, improving diagnostic accuracy, and enhancing patient outcomes. Level 4, human capital development. Yet, Guyana also recognizes that a system is only as strong as its people. Therefore, we're investing heavily in human resource development. We're expanding the training of doctors, nurses, specialists, technicians, and healthcare professionals to ensure that our human capital grows alongside our physical and technological infrastructure. Level 5, research and innovation. Looking ahead, the next 4 years will witness one of the most transformational developments in Caribbean healthcare. At the center of this vision is the creation in Guyana of a life science park, a sprawling hub of medical innovation, research, biotechnology, and advanced healthcare development. The Life Sciences Park will host biobank storage facility, a tropical medicine institute, centers for drug and diagnostic development, and state-of-the-art vaccine and biologic manufacturing facilities. It will support cutting-edge research, translational science, clinical trials, data analytics, and biotechnology innovation. It will help position Guyana as an emerging regional leader in healthcare and life sciences. Importantly, our natural gas resources will provide a low-cost energy advantage for data warehouses, advanced computing facilities, and AI laboratories. In parallel, we're developing a fully integrated emergency medical services system in collaboration with Northwell Health, one of the leading healthcare networks in the United States. I'm not telling you all of this to simply brag about what is happening in Guyana. I'm detailing the transformation of our national healthcare ecosystem because these developments create tremendous opportunities for collaboration with India. India has long demonstrated that healthcare innovation can be scaled, affordable, and transformative. India has become a global center of medical excellence, pharmaceutical manufacturing, biotechnology innovations, digital healthcare solutions, and healthcare training. Guyana values the friendship and partnership with India deeply. During one of the darkest periods of recent history, the COVID-19 pandemic, which many countries struggled to secure vaccines, India stood with Guyana. India extended support when it mattered most. Those acts of solidarity are remembered and they're appreciated. Today, as Guyana transforms its healthcare system, we see enormous opportunities for deeper collaboration with Indian hospitals, medical universities, pharmaceutical companies, biotechnology firms, digital health innovators, telemedicine providers, and healthcare professionals. We welcome partnerships in research. We welcome partnerships in training. We welcome partnerships in technology. We welcome partnerships in investment. We will need more doctors and nurses to work in our health sector. The future of healthcare will not be built by one country acting alone. It will be built through partnerships. It will be built through innovation. Guyana stands ready to be part of that future. Guyana sees India as a vital ally in helping to revolutionize its healthcare system. We need expertise and experience that accompanies healthcare transformation. We need expertise and experience that companies and healthcare providers in India and elsewhere can provide also. I invite you to come to Guyana and explore the unfolding opportunities in the fastest growing economy in the world. The future belongs to Guyana, and we want you to be part of that future. Thank you, and I wish this conference, this health summit, every success. God bless all of you.